Hi everyone, this is Catherine with 3 Home Bases, where I talk about how having modest homes in the UK and Italy enable our family of 3 to live indefinitely in Europe as tourists without jumping through any residency hoops. So I've done a few videos on full-time travel in Europe for $1,000, starting at $1,000 a month. And this 1,000 includes all your flights, all your airport and city transfers, all your accommodations, and food, groceries, and eating out. So obviously that doesn't include other things like health insurance and your cell phone plan. One could argue that, unlike streaming subscriptions, entertainment, and sightseeing, health insurance and cell phones are necessities. I also think a good travel credit card with evacuation insurance is a necessity, and some disagree, but I'll talk about that in more detail later. So, the reason I didn't include these costs is because they vary widely on the person. Also, these are things that are fixed costs you would have anyway, whether you were staying at home or traveling. So, with that said, I'll go over these in detail. I might do cell phones in this one video, I'm not sure. We'll see how long it is, but at minimum this will be the health insurance video. So I'm going to be kind of simplistic, I think, in a good way, but I joke that maybe this isn't the best advice, but I actually think it's a good broad stroke. Wish I'd had this video kind of video. I think it will help you. Of course, you'll drill down in more detail, but I think this will be a good broad strokes overview. So I'm sure there are other players, but to my mind there are 3 main players: Genki, Safety Wing, and Cigna Global. So with Genki and Safety Wing, they both have sort of a basic package and a complete package. The complete package is a lot more expensive. The big deal about the complete package is they're renewable indefinitely. So that means if within the first year you develop what becomes in future years a pre-existing condition, they say that they will not deny you, they'll renew you indefinitely. I think there might be some fine print to that where maybe they don't renew you, but that's what their website says. So obviously the price difference is vast. For example, with Genki, for a 25-year-old, if you get the essential 1 to 12 month package, it's only $53, and if you get the what they call native, a more complete package, it's $162. And then for someone who's 45, the lower package would be $80, and the full package would be $306. And you don't have to write this all down, because I'll put all my notes in a Google Doc and I'll link to it in the description. You can just read it there. So at 55, the inexpensive Genki insurance is $110, and the one that renews indefinitely is $508. So obviously I think there's a point at which these travel insurances don't make sense. And then at 65, the basic Genki is $168. Oh, I said dollars, but for Genki it's in euros. You'll see it in my notes. And then the comprehensive Genki one doesn't even cover anyone over the age of 55. I'm 57, so anyway, Safety Wing, similar numbers. They're essential for, I'll basically say young people 18 to 39 would be $63, and then at least they cover 60 to 69 at $219. And then their more complete package that's renewable theoretically for someone 18 to 39 is $178. And for someone 60 to 64, at least they cover people over 55, it's $682. You know, I think that's a lot. Okay. So, I have to say, with Safety Wing, when I was doing this research, I came across this thing they have now called Global Citizen. So it includes income insurance, like up to $4,000 a month if you lose your job. So I just think that's so cool for anyone who's considering being a full-time nomad, but the job security issue is what's holding you back. You know, look into a Safety Wing Global Citizen. Okay, so the third player is Cigna Global. And one thing about Cigna Global, which we have, is, once again, theoretically, they renew indefinitely. In reality, I think there might be fine print, but that's what they say. So they don't publish their rates, but just know for our family of three, we pay $582 a month. My husband and I are both 57. Our son is 22. And we all three have pre-existing conditions which we understand are not covered. So that brings us to the conversation of pre-existing conditions. And obviously this conversation is more for people in the US because thankfully people in other countries don't have to have this awful conversation surrounding healthcare and health insurance. So we in the US do. So anyway, none of the plans that I discussed above cover pre-existing conditions, but I don't think that should stop you from traveling. You know, different strokes. But for example, our son has autism. He's an adult with autism. Luckily, he doesn't take any medications for it, but I think if he did, based on what we've learned, it would be okay. My husband has high cholesterol. That's a pre-existing condition. So he just takes statins for that. And so far, he got a refill in the UK, and I think it was like 10 pounds. It was not a burden at all. I had a diagnosis of rheumatoid arthritis in 2017, 2018, and I was symptom-free by 2019 because I did some stuff that I looked up on the internet that doctors will tell you not to do, but you should do. Anyway, they recommended that I go on methotrexate, and I never did. I just did the other hippy-dippy things that I found online that worked. But if I had, I remembered at the time, it was stunning to me. It would have been $600 per month. So that would have been my cost, and then the insurer cost would have been $3,000 a month. I just looked it up. If I were to get a methotrexate refill in the UK, it would be £5 per month. That's like $7 a month. Versus in the US, it would have been $600 a month. And that was with me having supposedly good insurance. So that's why you can see that maybe managing even your significant pre-existing conditions is okay, especially outside the U.S. It's just more manageable. So, but if you have, significant concerns regarding, say, pre-existing conditions, or if you really like your doctor in the U.S., first of all, I think that's great. I haven't had a doctor I liked since like the late 90s, maybe. My last primary care physician misspelled cesarean. But anyway, if you really like your U.S. doctors, then you should probably get an ACA, Affordable Care Act plan. And I can't really give you numbers on this because it varies widely by state, but there is a website, kff.org, and you can sort of start there to get an idea of what you would be paying for that. And I plugged in our numbers, and for our family of 3, like I said, the 2 of us, my husband and I, are 57, our son is 22, and our income is very modest. We would be paying a little over $200 per month. But if someone my age had an income of $100,000 a year, which is not what ours is, they would be paying $800 per month. So at a certain point, and of course it depends on the person, to me it would not be worth it to get an ACA plan. You could add U.S. coverage to Genki or Safety Wing or Cigna, and those costs vary, but I bet it's not an additional $800 per month. So one thing, if you do want to keep an ACA plan, Affordable Care Act plan, or if you want to receive any, hopefully it doesn't happen, but if it does happen and you need significant medical care and you only want to receive that in your home state, then another main thing you need, I think, is travel evacuation insurance. And any good travel credit card, like with Citi or Capital One or Chase, they all have this insurance included with their cards. So if you don't have one of these cards, I think both Safety Wing and Genki have travel insurance as part of their plan. But, of course, check. So, given all that, just so you know, we don't have ACA insurance. We do have travel evacuation insurance if we need it, but I am comfortable with, if the possibility happened of us needing significant medical care, that we would just receive it where we are. We wouldn't feel compelled to be evacuated back to the U.S. I'm about 6 months in. Even though it's a new place and I'm a stranger in a strange land, I'm very comfortable here. It would be more uncomfortable for me right now if I had a major medical situation to, on top of that, have to be flown back to the U.S. and it's just not a great time in the U.S. right now. So, but anyway, different strokes. Hi. Excuse me. I'm adding this part the night after because I realized in the morning I forgot to talk about Medicare, which is a significant part of healthcare in the U.S. Although I'm a little annoyed with Medicare after the little bit of research I did. You always hear that Medicare is free, and it is. Part A is free, and that's the part that covers hospitalization, skilled nursing facility care, and hospice. But Part B, which covers your doctor's visits, preventative care, etc., Part B is not free. It's $200 a month. So I think you would get more bang for your buck with the cheapest plans from Genki and Safety Wing, which are also around $200 or less per month for people 65 and over. But once again, if you love your doctor in the US, then paying for Part B makes more sense. And then, of course, make sure you have evacuation insurance, especially if you have Part B. But also, you could risk having nothing but Medicare Part A if you're of the age, and then you would be paying nothing for health insurance because Part A is free. And so make sure you have your evacuation insurance, of course, with a credit card. So, in brief, and here's my bad advice, that I don't think it's bad, but I think get the cheapest basic insurance you're comfortable with. And that, I'm uneven there. That varies by person. So, for example, me, right now, I am not comfortable with a non-renewing plan. So we have Cigna Global, which is, once again, in theory, renewing. And other people are comfortable accessing healthcare overseas and knowing that they won't go bankrupt, even if a major medical thing happens, and they're willing to roll the dice by not having insurance. That's not me, but if that's your comfort level, then, go for it. So just to recap, once again, we're only 6 months into full-time travel, and we've been loving it. And doing this prep for this video has made me think about our Cigna Global plan, and I think we'll probably keep it. It is renewable in theory, and right now we're paying just under $600 a month for the three of us, which is a significant cost. But once again, that's good for our comfort level. So anyway. Okay, so that's the simplistic explanation of healthcare for full-time travel. Cell phones. I think it's okay to admit we need our cell phones. It's a necessity. So there's a cheap way to do it and an expensive way to do it. We did the cheap way, and I'll tell you what that is. Once again, it'll also be in my notes. So the first thing you do is transfer your number, and this is the one that you've had, most of your life, that all your family and friends know. Transfer that to Google Voice, and that's a $20 one-time fee. Oh, this is for people in the U.S. And then after that, anyone can call or text you. It won't be as fancy. You'll see with the texting. It's a primitive form of texting, but you'll get your text messages and your phone calls and stuff like that. Now, If you require strict two-factor authentication that requires a native cell number, then get a native cell number. And just so you know, for example, I still do payroll for a small nonprofit, and ADP, the payroll processing behemoth, would not take my Google Voice number. I had to have a native cell number, so that's why I got a number with Tello. Also, some banks do not take my Google Voice number. The main ones do. Chase, Capital One, Citi do, but little mom and pop banks that we have accounts with, for some reason, they don't take it. They require a native cell number, so we use Tello for that. Anyway, that can be just $7 a month. And then, so if you'll be mostly in Europe, here's my strategy for you. Start in the UK, just fly into the UK, and then when you arrive, go to Leica and get their cheapest plan that makes sense for you. For example, I just looked, and there's one that is 30 gigs per month, which is a lot in the UK, and 12 gigs per month in the rest of Europe, and it's £5 for the first 3 months, and then £10 a month after that. So I would do that. Otherwise, if you're not going to start in the UK, or you're not going to be mostly in Europe, then just start with Airlo. They're kind of the biggest eSIM company, and then just start with the cheapest plan that makes the most sense for you. And then once you arrive and you're here, you'll figure out what your best eSIM situation is for you by just Googling or talking to coworkers and whatnot. So, and then of course, make sure you have good free Wi-Fi at your hotel or Airbnb so that you don't have to use up all your data. Okay, so that's the cheap way. The expensive way is to just keep your number, and then if you're 55 or over, switch to T-Mobile Magenta, and that can be $50 to $70 a month. If you're under 55, then Google Fi can be $35 to $50 a month. Although with Google Fi, after 90 days out of the country, your data stops and you have to supplement with an eSIM. And then a new one I just learned about, Popcorn, is $70 a month, and that's unlimited, and there are no restrictions about 90 days or age or anything like that. So once again, this will all be in the Google Doc. And I know this is simplistic, but I don't think it's wrong. I hope it helps. And yeah, have a good day. Bye.